Well, good morning everyone. My name's Damien Longson. I'm a psychiatrist at Greater Manchester Mental Health and I am one of two R&D directors for the organisation. It's my pleasure to chair this morning's session. So I'm going to try and keep us very tight on time, and the speakers have been variable in how much they need to say and how much they want to hear from you. So I will try to introduce each one with a clue as to whether there'll be some questions or not. But as has been emphasised to me, the whole day is about networking. There are roundtable sessions. There's an awful lot of networking that's going to go on. And many of our speakers are staying for the day. So if you have questions, if you've got burning ideas, you want to talk to the speakers and to each other, please do so during the roundtable sessions and during the breaks. So for our first speaker, which is Prof. Panos Constantinides. He is the Prof of Digital Innovation at Manchester Business School, and I've been told he's the author of this book called Digital Transformation in Healthcare, and he is going to talk to us about an introduction to health ecosystems. For me, this is a whole new world as well. As Tony was saying, it's very, very exciting, I think highly relevant to the patients that we're looking after, and I'm really, really excited to be introduced to the topic. So, Panos.
Okay, good morning, and thank you for inviting me. My name is Panos Constantinides, and I'm going to give you a perspective on digital innovation, ecosystems, and how they can accelerate digital transformation in healthcare. And also, thanks for the plug for the book. I'm happy to talk to anyone who wants to find out more. So, national health systems like the English NHS have historically suffered from institutional problems of trying to cut down costs on the one hand, and on the other hand, trying to make rationing decisions at the bedside in an attempt to improve the coverage of healthcare services across the population. And many of these inefficiencies are due to limitations of hierarchical forms of organizing healthcare that are very much driven by supply side constraints. Right? How much money do we have? What's the budget for this? Right? This has increased costs in treatment, in diagnostics, and the delivery of care. Every day we see these news clippings on our screens about many services failing. And mental health services is one of the many casualties of the inefficiencies of current health systems, as you see on this slide. And this is from a report from the World Health Organization that talks about lack of resources, lack of coverage, and also poor governance of those services. Another trend we observed during and post the COVID-19 pandemic is an increase in the download and uptake of mobile health technologies, including virtual and augmented reality applications, as you see on the slide. And these are just some of the examples of the companies that are out there. I'm sure there's many speakers in the room today that will be talking about what's happening in the UK. And from the discussion so far, and I'm trying to be as brief as possible, disruption in healthcare happens from a number of different forces, right? COVID-19 has been a catalyst, as we all know. But it's not just COVID-19, right? There's a lot of tech companies entering healthcare, the healthcare sector with an initiative to supply alternative solutions, and I will be talking about some of those, to address some of the shortcomings of our current healthcare delivery. I talked about the supply side constraints, including the capital investment in resources that are often based on geographical boundaries and not necessarily meeting the individual needs of whether it's a primary care center or a trust. Priority setting, implicit rationing, these are all reported, and there's a wide literature on this. But also on the demand side, there are pressures from new medical technologies in the context of mental health, and I'm not an expert, I know though there are new drugs, new psychedelic drugs that are being implemented. There's obviously genomic research that allows you to predict a lot of the conditions that may develop over time. But also new technological innovations, right? Mental health applications with the use of VR and AR technologies. And most importantly, patients are becoming more empowered. They're being more informed about their conditions. They want to take hold of their conditions. They use smart devices, personal applications, and they want to care for their own health and wellness from their comfort of their own home most of the time. So evidently disruption is systemic and digital transformation complex. And it is complex because it involves a number of, on the one hand, coordination problems. So who should do what, when, and in what quantities, right? What kind of systems should we implement? Should we adopt AI? Should we adopt AR? Should we adopt XR, right? To what extent? What would be the use cases? What are the costs? And on the other hand, we have cooperation problems. What kind of incentives do you provide your various stakeholders that get involved, whether those are research institutes, whether those are technology companies, whether those are regulators, right? In order for them to realize some of the value that is being proposed. And the classical remedy to such problems from an organization point of view has always been vertical integration, because the assumption there is that a single actor or a centralized actor has better control over the risks, the potential risks that may emerge, including opportunistic behaviors from a group of actors that may want to take advantage of others. But the reality is that we live in a world that increasingly there are solutions that are provided by a number of different, not only technology providers, but increasingly so also academics, universities in joint with research centers and R&D labs. And it becomes very difficult to, as I said earlier, choose from those solutions. And more importantly, the user needs may often be very difficult to identify upfront, because the user needs become emergent in the use of those applications. And therefore, the key argument that I'm trying to make, and this is also the key argument that I'm making in the book, is that the complexity of coordination and cooperation problems can be reduced and risks mitigated if organizations start to work together and to realize joint value propositions to an ecosystem. Because by doing so, they can implement solutions that can scale, that have a wider scope than if trying to do everything alone. And also, they can exert greater influence on other actors with a longer term impact. So what is an ecosystem? And I'm trying here to abstract an illustration of what they would look like. And you can see how you could remove some of the actors and the resources and capabilities and put others there. But the key idea is that an ecosystem is a set of multiple heterogeneous actors that are codependent on one another. They depend on others for capabilities and resources they do not have, but which are necessary for a joint value proposition to be realized. So this set of actors can start to combine synergistically their resources and capabilities, whatever those are. As you see here, there is a number of different resources and capabilities, right? From omics data analysis capabilities, from biodata, right, that can be provided by, again, organizations that are either non-government or government-supported machine learning experts. But on the other hand, you also have healthcare service providers, insurance providers, pharmaceutical companies, and so on. And this set of actors can combine those resources to create products and services whose value will be greater than the sum of the individual parts. So therefore, ecosystems support open innovation, which I think fits very well with the theme of connected healthcare ecosystems and this event. And digital platforms play a key role in this because they provide the key resources that would bring those actors together, such as an XR devices or an XR mobile application platform. And more importantly, they can provide seamless access to those services to patients, which is what we should be focusing on. So let me give you one example. AptiHealth is a digital platform ecosystem based in the US, and I don't know if you can see the slides, but happy to share the slides afterwards. In fact, I have already shared them, so happy to be given to the public. They work with insurance providers, national payers, behavioral health specialists, and psychiatric prescribers to provide mental health services on demand. Patients can go online, they can create a profile, and then they can start interacting with health specialists either through virtual consultations or via text. And they can manage their health and wellness over time through a number of different services, as you see there, either talking directly to them, sending messages, keeping track of some of their activities, and so on. And one study found that the platform actually expedites primary care referrals to mental health care specialists. It increases access to virtual consultations and care, and also reduces some of the symptom severity and the visits to emergency care. And in fact, it does reduce hospitalizations, which brings down the overall cost of the delivery of care. And AptiHealth is just one example. Another one is XR Health. It provides patients with an XR device, and then they can do a number of activities at the comfort of their own home. And it includes a number of different applications, from cognitive treatments, as you saw there, mindset or healing-related activities. And all the data is collected and transferred to the provider, and patients can track their progress with their mobile app. And as you see here, there's also virtual support groups that, again, increases access to these kinds of services. So while broadly known for applications in gaming and training, XR applications are becoming increasingly adopted and developed within the context of healthcare. As you see here, there's a number of different applications. And I want to finish with a snapshot of a recent report produced by the NHS Health Education England, the UKRI, and I'm trying to get everyone, NIHR, and Rescape. They have listed a number of different benefits, including the reduction in cost in the service delivery, a wider access to patients and providers, and also a better interaction between them that can help health systems overall and the public to benefit from increased access to mental health services. So that was it. I hope this snapshot and summary of what the future can bring in terms of connecting across ecosystems and realizing some of the benefits of these technologies is now more evident to you. Happy to talk to anyone that is interested to find out more. Thank you.
We have a couple of minutes for questions to Panos. any takers?
Hi, thanks for that, Panos. Very interesting. I think what's really interesting today is Manchester's ecosystem has been around since Chris established it many years ago. But it's how we can plug in the best in show here today back into a network of ecosystems that we've got that Manchester are connected to across the globe. There's another 80 of these. Some details on your tables in front of you. But there's other ecosystems that are either in this area or looking for best in show for Manchester. So there's areas to learn from, but also areas to perhaps think about where we can target. We're just to think about how are you looking to internationalise things.
Yeah, so I am new to mental health care. We have just won an award to do a study on the use of AI in crisis prediction in mental health with GMMH. And I think that's why John invited me to come over. But we're also working with the Pankhurst Institute. I'm recently collaborating with Alex Frangi, the director, on his ideas of developing an in silico regulatory ecosystem that brings together regulators, academics, patients, and others to move clinical trials away from the physical and traditional way of doing it to computational models. I think there's plenty of opportunities here, and it is important to build these connections first and foremost, as we are doing today, and then try to propose research projects that would help us spearhead those ecosystems.
I just wanted to bring up the topic of equity of access. So, I'm not familiar with the provider that you demonstrated, but the reality is in central Manchester you have an aging, poor population. You have patients that have Nokia 3210s. They don't have access to high-speed broadband that they need to do that. But you can't approach this from just a health perspective. You're not going to have buy-in from health education in England because they are very slow in doing anything. But it's more about what actual governments are going to do. How are you going to lobby government to actually provide the natural resources that need to be available in the environment to even deliver half of what these services provide?
Yeah, that's a very good question, and I absolutely agree there needs to be a policy change, not just innovation from the point of view of technology. I'll just use one example. Virtual wards have been around for more than a decade, right? And the value of them is evident today, right? Because the NHS has started using it. The example there is interesting because over time they have shown the NHS that the costs of delivering services at home as opposed to bringing people into the hospital and hospitalizing them, right, is 1/3. 1/3, right? And they have shown those simple health economics, right? And that's what's going to make a difference to the policymakers to change policies to bring those technologies into their homes, into the homes of those that need it the most, right? Now, obviously, there needs to be a lot of research and development and application to show the benefits, to actually show the benefits. And I think this is where us, the academic community, come into play. We need to do the research, we need to apply the projects to show the benefits before then those smaller pilots can scale up into the community. It's a long process and it's a difficult one. Yes?
So you mentioned virtual worlds from a colleague there as well. I just want to make a point, and I don't know many colleagues in the room probably already understand this, but my research so far is social VR, and I conducted that during the period of lockdown in Altspace, owned by Microsoft. They've since decided to shut that virtual world down with huge implications. So the point I think I'm trying to make, which is very important to be addressed today, is when you've got commercial organisations that are controlling our ecosystem or our virtual worlds, we need to be lobbying them as well, not just government, but if a commercial project suddenly becomes non-viable, in Microsoft's eyes, for example, that whole ecosystem just suddenly disappears. So I think it's important that we address those issues as well and lobby the commercial organisations to ensure that if we do invest time and effort into some of these platforms, they don't just suddenly disappear.
Yeah, and I absolutely agree with that.